of honor.
And in our country, Uganda, the prevalence of kidney disease is about 2 to 21%. In some populations, like amongst people that have diabetes, hypertension, the prevalence even goes as high as 21%. Now, what this means to us is that we are going to see more and more people having and presenting with kidney diseases. Kidney disease in Uganda is one of the top 10 killers. And the unfortunate thing is that in Uganda, we don't have an inclusive health insurance where people can get access to free services. There are many people that die undiagnosed in our country.
As you can imagine, putting in a catheter, it's 2.5 million. In some areas, they charge you 5 million. Now, for me, I've put in 6 since I started dialysis. I've put in 6 catheters. Now, each session, on average, every week you have to spend $1 million in terms of drugs, in terms of consumables, in terms of what you subsidize and what you pay. That is what we spend on. The other problem is the fewer machines. Now, I hear in Chirudu, they do 2 sessions. Why do they do 2 sessions? Because it is cheaper in Chirudu. And so the number of people suffering from these kidneys are so many. So they can't afford for people to do 3 sessions.
So when we started off this project, our main objective was to increase access so that people can have an opportunity. There were, of course, other dialysis centers within Uganda, but there were fewer then, and the cost was also high. So the second objective was actually to reduce the cost of dialysis.
Whether I redo the national anthem